Hello, welcome everyone to this important plenary session on tackling climate change and the role of health services research. I'm Tara Lamont. I'm a trustee for HSR UK with roles supporting NIHR and this institute at the universities of Southampton and Cambridge. So I think you're familiar now with the housekeeping. And to remind you that do please submit questions through the session using Slido, and we'll have a debate after our great speakers. But let me start with a question for you. How many years before we reach 1.5 degrees warming? So if you go to Slido, you'll see some options to vote. How many years have we got? Tim, are we okay to... No, sorry, let's have a look. As the votes are still coming in, I mean, the answer is sort of nearer than you think. So we were working towards an estimate of 2033, but as you all, being researchers, seem to correctly know, that a report in May from the World Meteorological Association put it as a 50-50 chance of happening within the next 5 years. So we know it's urgent and it touches us as health researchers in many ways. So Nick Watts, the Chief Sustainability Officer for the NHS, speaks compellingly about how the climate crisis is also a health crisis, from air pollution to heat-related deaths, and affect us unequally. So it's also an equity crisis. And we'll hear more from Aarti about what the NHS is doing to respond to this crisis in an ambitious net zero plan and quite radical change. But I think a point is this isn't bolt-on. So David Pension, who's a pioneer in many ways in terms of action on sustainable healthcare in the health service, says we have to think about sort of greening the NHS as a dimension of quality of care, and that changes to services to reduce the carbon footprint can also reduce costs and improve patient outcomes. So we should be looking for a kind of win-win. And we're talking here about whole system changes, for instance, changes across renal pathways to reduce water and energy use, reduce waste and the number of patient journeys. But it's partly about improving the patient experience. So this urgent need and the rapid adaptation and transformation of services provides opportunities for research. I've been involved myself with 2 initiatives this year around these opportunities. So at this institute, we just awarded a series of exciting postdoctoral research fellows, bringing new disciplines like engineering, architecture, clinical expertise, together with social sciences knowledge, to address topics from greener procurement, future-proofing NHS estates, to the kind of circular economy, more reuse, repair of medical instruments and so on, and how you engage hearts and minds along the way. NIHR has put out a call inviting ambitious new research across all its programmes, and within the programme that I support, HSDR, we're hoping to fund some proposals that might be evaluating service and system changes, and those projects are being considered now. And I should say, probably true for all funders, but certainly true for NIHR, greening the NHS, sustainable healthcare is going to be an enduring strategic priority. So we had a time-limited call, but there's opportunities for you to continue to submit important research ideas. I think too, sustainable healthcare provides challenges for research in terms of appropriate study designs, given the urgency of decision-maker needs and that timeline that we know we're working against. So there's an important debate around adaptive, responsive methods, good enough, summative findings and how we share them. But given the equity issues too, the need for good participatory research, it would also be great in this session perhaps to think about how we as a health services research community can support new researchers in this emerging field. I've said perhaps bringing people in from disciplines outside health and what kind of peer support we can provide. So to get us talking about the kinds of research we need and also what we already know from evidence around health beliefs on climate change, I'm delighted to have some big thinking from our speakers today. So we're going to hear first of all from Professor Hilary Graham, who's Professor of Health Sciences at the University of York and Associate Director of the ESRC Centre for Climate and Social Transformations. So Hilary's a sociologist and researcher in public health, inequalities and climate change over many years, and also was a member of the influential Lancet Countdown on Health and Climate Change Initiative. And we're then going to hear from Aarti Bansal, who's a GP here, I think, in Sheffield, who founded the Greener Practice Network 5 years ago, and she's the net zero lead here in Yorkshire and Humber. So we're going to start by going big with Hilary, explaining a bit about the kind of social sciences evidence on climate change and public attitudes. And then Aarti's going to talk more about how the NHS is responding to climate change and what research the NHS needs. And there'll be opportunity for questions. Do keep those questions coming on Slido as we hear from our great speakers. So, Hilary, over to you.
Thank you very much. I want to make two introductory comments, one very practical and one more community-oriented. The first, the community-oriented one, is, as Tara indicated, I used to work pretty much exclusively around health inequalities, particularly looking at health behaviours. Climate change is a new field for me. I've been working here in this field for about 5 or so years. And we need to grow this field, and we need to work collaboratively. And I'm going to present a snapshot of some of the things I've learned, but we're all learning all the time. And so my first message is really this has got to be a huge collaborative effort. We've got very little time and a hell of a lot of work to do. The second, very, very different observation is I have a dry mouth condition, which means I will be sipping water all the way through the session, and I'm very sorry it's distracting. If I get running out of water or it's not having effect, I have a packet of sweets in my mouth. Okay, so I'm not that recalcitrant child at the back of the class eating sweets. I'm doing it for quasi-medicinal reasons. Okay, so to get on, what I want to talk about is some observations on public perceptions of health and climate change. And I'm going to cover 3 areas. Very briefly, some background, then setting us some questions, and then presenting some data. And the data is speculative. I'm opening up some questions about how the public in the UK, I'm looking specifically at the UK, think about climate change and think about climate change in the context of health. Sorry. Is that better? Great. Okay. So the first up is I wanted to make a few background comments. I start with the mission of public health, which for us who work both I think in health services research and public health, the mission of public health is to ensure the conditions in which people can live healthy lives. I think we all share an understanding that those conditions are being undermined at great speed by climate change, and underlying that is the increasing greenhouse gas emissions. the government brought out a UK climate risk assessment that some of you may have seen. I think it's about February time this year. And it talked about the very high risk to health from high temperatures and to people and places from river and surface flooding. Aarti is going to be talking more about the net zero plan that the NHS has brought out, but that is in the context of the UK having a legally binding target to reduce greenhouse gas emissions to net zero by 2050, which means a huge reduction from where we are now. In relation to the net zero ambition, as I'm sure Aarti will explain, there's commitments around the carbon footprint of the NHS. Those are the areas in which it has direct control, and then what it calls the carbon footprint plus, which is that the emissions that the NHS can influence through its supply chains and travel. So what I want to do is talk about public understanding and engagement, because it's critical if we're going to get public buy-in and public support that we understand more about how the public are currently thinking about climate change and health. A health framing of climate change, namely thinking about climate change in terms of its impact on people's health and the potential health benefits of climate action, has been repeatedly advocated, and I give a quote here, as it makes the problem more personally relevant, significant and understandable to members of the public. And that health framing underpins the Lancet Countdown on Health and Climate Change, which Tara mentioned, which I've been involved with since 2014. And the idea there is, through the aegis of the Lancet, is that if we bring the health impacts of climate change to public attention, it will engender greater buy-in and support. So I want to focus with that as a backdrop. Is a health framing useful in terms of public engagement, focusing on people's perceptions of climate change and its impacts on health? So, questions, 2 questions. What are people's perceptions of climate change? And I'm going to be talking about the UK. I think it's different elsewhere. And do people connect climate change and health? Now, if we look at qualitative and quantitative surveys, they give a slightly different picture about the answers to those questions. So I'm not going to summarise that literature, but in basic terms, that's what they say. We get different messages when we use different methods. But so I want to illustrate some of these differences through a survey I've been involved in, which is funded through the NHIR Public Health Policy Research Unit, which I'm sure some of you are familiar with the structure of PRUs, but they have a topic or client group, patient group focus. And I've been involved in a project looking at public perceptions of the health risks of climate change and the priorities of action. I'm going to be talking about the first bit, the perceptions of the health risks of climate change. In this study, we covered a number of areas in the quantitative and qualitative components, and you can read about the methods on the slide. Online surveys compared with large numbers of participants compared with a relatively smaller qualitative study. And I'm going to be looking at the quantitative findings on perceptions and the qualitative findings on perceptions in order to illustrate some of the differences as well as overlaps that emerge. So I'm going to start with the quantitative findings on climate change concern. So in our quantitative surveys, and this is from quite a recent one done at the end of the year, straddling the COP, designedly straddling the COP. So half the sample was sampled before the COP and half after. And did the COP make any difference? No, if you're going to ask me that question. To what extent, if at all, are you concerned about climate change? Now, this is a very standard question. Our findings are reproduced across surveys that have used this for the UK. So you can see that most adults express concern. They're either very concerned or they're fairly concerned. Very small are not concerned at all. So what does the qualitative data add to the picture? So for that, we asked, when you think about climate change, what do you think about? We get a rather subtler picture coming from this. It's very concerning, said one participant. We're very lucky in this country. But, you know, those who are living in other parts of the world are badly affected. And, you know, it's hugely bad news for them. Images come to mind. Images on the news come to mind straight away. It's those kind of images that I see, you know. And I just see all that's happening, those images that come to mind straight away. And those images, as in the one before, are images and insights and perceptions relating to places beyond the UK. We can't put a finger on it, summarised by one participant, of the sorts of observations that other participants were making. We can't put a finger on it. You know, we can't. In England, I think we have a long way to go before climate change. So concern about climate change, but a perception that it's happening somewhere else and has yet to come here. So there was concern about climate change happening elsewhere and seen happening in the future. So just two examples here. It's a worry, obviously. I've got children and grandchildren, and I'm thinking, what's the future of the planet? And then another example, we think about children as the next generation, as the future. So therefore, when I'm thinking about climate change, obviously, I'm thinking about the future. So concern, but something that's seen as happening elsewhere and a future threat, perhaps more than a current threat. So moving on rapidly, I want to say a little bit about the perceptions of the health impacts of climate change. So the quantitative survey, we asked, which of these statements best describes your views about the impacts of climate change on people's health in the UK? So you can see already having an impact on people's health is the majority. Having an impact in the future is a minority, and very few say will never have a health impact. So that would suggest for 61% of the sample that a health framing may well be a good way of making climate change personally relevant, significant, and understandable, to use that quote. So what about the qualitative data? In the qualitative survey, we asked, what are your thoughts about the impacts of climate change on people's health? So remember the background, 61% said it was having effects on people's health in the UK now. Until you mentioned this interview thing, I like interviews being things. Anyway, until you mentioned this interview thing, I never thought of it in terms of the consequences for human life, because other life took precedence in my mind. I don't really associate climate change with actual, like, people's health. I don't think a lot of people would relate health per se to climate change and global warming. I feel when I think about climate change, I think about the destruction of the natural world, I think about my garden, and I think about the animals in it and the wildlife in it. I guess I don't think about it in terms of individual health. I don't think about it in terms of people's personal, like, health and fitness, but more on a global social scale. So a rather different picture about whether or not health and climate change are linked in the context of the UK emerges from the qualitative studies. So moving on to some conclusions, and I know this is no surprise, I think it's really important to have multi-method approaches. We get different answers sometimes, we get more nuanced answers sometimes when we use qualitative data combined with quantitative data. So concerns about climate change, the first area I wanted to cover, perceptions of climate change. Both the quantitative and the qualitative note those concerns, but the qualitative data suggests that climate change is perceived as an extreme phenomenon. So if we listen to the quotes, we listen to what participants are saying to us, it's something that they imagine as manifested in major meteorological events and their associated impacts in California, Florida, Bangladesh, Germany, the German floods came up as well in the interviews. So they think about it in terms of major meteorological events, extensive flooding, wildfires, intense heat waves, and not as a change in climate patterns over the last 70 years or so, affecting all regions of the world. And we might want to have a discussion about how climate change is represented in scientific reports. And that's how it's represented. This worldwide phenomenon that's affecting changing climate patterns globally. So given that it's seen as major meteorological events, it's not surprising that in the qualitative study, climate change is not seen as hitting the UK yet, but there's concern for future generations. And then in relation to the perceptions of health impacts of climate change, a different picture emerges from the quantitative and the qualitative. The quantitative suggests that public perceive climate change as impacting on UK health now. The qualitative suggests not, because perceptions are framed by people's wider perceptions of climate change. And those perceptions, I hope you get a sense from the data I presented, those perceptions of climate change is seen as episodic, unexpected, and life-threatening. And understood in this way, participants found it difficult to identify impacts on health. And if you look at the media coverage of climate change, what comes out is a term called disaster reporting. So it's these extreme meteorological events that are reported. And there seems to be an interplay between public perceptions and media reporting of climate change. And finally, the public engagement in climate change is critical to addressing climate at the scale and speed required, as I said at the beginning. So I return to the question, does a health framing of climate change make the problem more personally relevant, significant and understandable to members of the public in the UK? And with people struggling, it seems, to connect climate change to health in the UK from the qualitative data, would other framings have greater personal salience and enable a deeper emotional connection? So if we look at the qualitative material and other studies as well, the impacts of climate change on the natural environment and on future generations, children and those yet to be born, were ones that participants, as I say, both in our study and other studies, spontaneously discussed. Are these impacts more meaningful to the public in the UK than a health framing? And would coupling health climate change with environmental change and with children's futures, rather than with health, speak more directly to people's perceptions and values? Thank you.
Suddenly thought, I wonder if my mobile phone's turned off. So I'm just going to check that first. You never know when school's going to ring you. All right. Thank you so much for inviting me to come and talk to you today. I'm feeling quite honoured, slightly daunted. I've kind of dipped my toe in the past in the research world. Just before my current position as a one-day-a-week net zero clinical lead for Humber and North Yorkshire, I was doing 3 years, very part-time, research, NIHR funded realist review, and I was an educator for about 15 years in an academic environment here at the University of Sheffield. But I don't really see myself as a researcher. I'm not steeped in that world. So today I'm talking to you from that perspective of somebody who's trying to enable action on net zero NHS. I feel like I may not have put enough in this presentation about what the NHS Net Zero programme is, but, you know, I can talk about that later maybe in questions. So it's really interesting to hear all of Hilary's research and my own experience for the last 5 or 6 years of talking about this, mainly to health professionals rather than the public, is the importance of that health framing. So this diagram that you see above you, what people understand is that central circle. You know, we all have watched the David Attenborough documentaries and various other things that tell us, yes, we're going to have rising temperatures that are going to cause more extreme weather, sea level rises, and all the disasters that come from that. But actually, it's really important that we recognise that on a daily basis, all of this is impacting our health. And it's not just the weather pattern changes, it's the things that are caused by the burning of fossil fuels or caused by the extractive processes that are also impacting us. So Tara mentioned air pollution at the start. You know, we have approximately up to 36,000 premature deaths every year in this country that are attributable to air pollution. And where is the outrage about that? You know, we shut down our economy to try and prevent deaths from COVID. You know, that was probably the right thing to do. But what are we even changing to try and reduce the number of deaths that we're having from air pollution? And that's just one of the impacts. Some of the things that, as healthcare professionals, we will see in our day-to-day, you know, for me as a GP, you know, in my consulting room, will be an increase in infectious diseases. I'll be having to consult with patients who have high blood pressure or heart failure and actually talk to them about what they do on hot days, you know, and how we might need to change their medication. But it's also got an impact on our ability to grow food, huge mental health impacts as well. So it is a health issue. You know, we talk about it as an existential issue. Well, before existence comes the impact on health and well-being, and this is very much a health issue. And when I talk to health professionals, often that is the thing that sort of helps them sort of connect with wanting to care about this. And the WHO says climate change is the biggest health threat facing humanity. But actually the thing that helps move people even more, I think, is what Hilary's been part of, the Lancet Countdown, which says that tackling climate change could be the greatest global opportunity of the 21st century. And the way that I see it is all the things in public health that we would want to do anyway are basically the same things that we need to do to mitigate climate change. So it's an immediate health benefit. We're talking about prevention, yeah? So we're talking about the definition of public health, creating the conditions in which people can live healthily. So clean air, access to green space, access to the ability to be physically active, access to good diets. And actually, a planetary health diet is exactly the same as a healthy diet. You know, it's pretty much the same plate of food that you would be suggesting that people eat. Integrated care services, meeting the healthcare needs of those who need it the most. So as Tara mentioned, addressing health inequalities, because it is a health equity issue, is absolutely core to this. So it's an integral part of what I hope we're all trying to do in the healthcare system. And you all know this, but this slide has changed a lot in the years that I've been talking about it. So we've already got a 1-degree fever. And probably need to revise that figure down of when we're going to hit 1.5 degrees. And we don't know when these multiple tipping points are going to happen, but they could happen fairly soon. So what does that mean? So in October 2020, Tara mentioned Nick Watts, the Chief Sustainability Officer, and there was a launch, actually, during the pandemic of the NHS's ambition to become a net zero service. And that's the first, we're the first health service in the world that has said that we have this ambition. But there are quite a lot of problems in terms of actually implementing this, particularly from knowledge generation point of view, because we're in a rapidly changing context. So I've been part of 2 research bids as a clinical advisor, and within the 6 months between somebody coming up with an idea to getting the team together, the question that they were trying to ask didn't seem that relevant anymore because the context had changed. Yeah. And also, we need rapid changes. You know, we can't be having research that has this timeline between asking the question to implementation, which I think was 15 years, and they're trying to get that down with a rapid, what's the word, Tara? Accelerated access. Anyway, so we're trying to reduce that, but that's the general timeline. The other thing is, from my point of view, because I'm most interested in how we reduce the carbon emissions in clinical services, it's all complex interventions. These are all patient-facing interventions, multiple sort of complex reasons for why things happen. It's not a drug trial. It's a complex intervention that we need to study. And we need transformative system change. So not incremental change, but transformative change. So really interesting but difficult challenges. And when I'm sort of sitting there thinking, what do I do? How do I get, like, I'm based in primary care, so my focus is on primary care. How do I get primary care to become net zero? I kind of broadly know what I need to do, but I don't know the most effective way of doing it. And I don't know what the impact of doing it will be. I know I can guess, but I don't really know. And that's what I kind of need help with. And when I think about the questions that I want answering, most of those questions are questions of implementation and evaluation. So I feel like we need to find a way of researching what's happening on the ground, because people are innovating and changing and doing things because things need to be done. In fact, only yesterday I was at a North Eastern Yorkshire Greener NHS celebration event, and all of the CEOs and everyone was just saying, we want you to ask for forgiveness, not permission. Please just get on and do things. Please be brave. So we're in this kind of urgent situation, but at the same time, we want systematic knowledge generation. We don't just want case studies, because case studies tell you it can be done, but it doesn't tell you how to do it and why it worked. So, we need that. And then, just to give you an example, so I've got a particular question at the moment that I want answering, which is, how can I support implementation of high quality and low carbon asthma care? So, just in case you don't know, our asthma outcomes are poor in this country, and we tend to use inhaler devices which are very destructive to the environment because they contain propellant gases. Now, we can bring those two things together and improve asthma care and reduce the carbon footprint at the same time, but we need to do it in a way that is done safely. We need to do it effectively. I need to know, who do I invest in, and how do I make that investment? And how can I do this rapidly? And then I also need to think about what's already happening on the ground, and is it working, and should I be doing it differently, and how can I do it better? Sounds very sort of quality improvement type stuff, really, doesn't it? But that's the kind of question that I need answering. So these are just thoughts, and I'm happy for you to disagree or debate them. But I wonder if the research community can evaluate interventions across different contexts to consider what works for whom and why. Now, I know I've put that in a realist sort of question approach because that's probably the only research methodology I fully understand. But basically, it's sort of an explanatory type research, participatory research as well. I think that's really, really important. I think we need research that gives us real-time findings. The data might not be definitive and it might not be causal. We need to know, are we on the right track? Because we're going to keep needing to do things before you can tell us the answer, but you need to keep giving us the information so we know that we're not doing the wrong thing. I know that Greener NHS and the NIHR are working quite closely together, that there are now bids specifically around net zero, and more of this is coming on. And as Tara says, this will be an ongoing sort of priority. But I do think that perhaps the research community needs to work closely with Greener NHS, not just to create the capacity for research to do this work, but actually to sort of talk to people like myself and say, what questions do you want answering? So a little bit more of a utilitarian maybe approach than the blue sky thinking approach. And also to be able to adapt our approaches and ask different questions in order to respond to rapidly changing contexts. So the research community needs to have that, as Tara mentioned. I felt like you said everything that I was going to say, Tara, in about 2 minutes instead of 10. Adaptive designs. So, how might the research processes and funding adapt? I think we can learn some things from COVID-19. When COVID-19 happened, anybody who could contribute to COVID-19 research contributed to COVID-19 research. And I kind of think we need that kind of priority with net zero. Anybody in any field who could be doing something to answer this question, we need an army of you to be working on this, not a tiny proportion, literally everybody, because there are so many questions and they're all complex interventions. And actually, if we're going to generate proper, robust, systematic knowledge, then we need lots and lots and lots of people asking all of those separate questions, whether it's about a clinical pathway or whether it's about evaluating an intervention or whether it's in the non-clinical areas of buildings and procurement or anything like that. We literally need thousands and thousands of you to do this work. I think we need to favour research which recognises urgent. Okay, we're not necessarily going to be able to define the outcomes of the research, and I think bids need to look at that to be adaptive around that. And similar to what I said before, research which captures systemic change over time and accumulates knowledge over the influence of different contexts. I think this is probably going to happen. I think we need continuous funding calls to enable people to apply when they're ready to go ahead, so that the timeline and the date of when a bid might open or call might open or when a bid might close isn't actually preventing the process from happening. I think we really need proper interdisciplinary research. I'm not talking about cardiovascular and public health. I mean like truly interdisciplinary research, because a lot of what we're talking about is really changing behaviour. And so we need media, we need economics, we need sociology, and it might not fit a particular research domain, it might not fit a particular category, but we need all of that different kind of thinking to help us really support effective change. Adaptive research designs. One of my research friends, because I did talk to my research friends before putting this presentation together, she sort of said, maybe we need something called meta QI, something that maybe sits above QI, but we do have explanatory research designs, don't we, that test, learn and adapt. And then the other thing is, I feel like there is a tendency in all of these bids to say, have you got a good idea? Have you got a new idea? We'll help you through with that idea from starting it out to sort of implementing it. There are a lot of good ideas already out there that are somewhere through the process of research that need the support to work out, is that still a good idea? And I don't necessarily think at the moment the research bids are actually supporting that. The other thing what else might need to change? Well, I wonder whether we need you guys actually sitting with us in the net zero teams, because I don't have access all the time on one day a week to learn about, what builds movements, what do we know in educational theory. A lot of this is educational research, actually, because it's about, building on from what Hilary's research is, what do people think, but then how do we change that? How do we motivate them? How do we educate them? How do we support them? And I might need you to tell me, this is what we already know. If you're going to design something, because I am going to design something, whether or not research tells me, I'm just going to go ahead and do something. But I'd like to do it well. I'd like to do it with knowing what we already know about the subject. And I wonder whether we need the research community a little bit more embedded in strategy and implementation teams. I also think from an ethics and regulatory process, because we changed that for COVID-19, we adapted. And the one thing we need to recognise in the ethics and regulatory process is we know for sure the risk of doing nothing, and that is extremely harmful. So when we're deciding what we do, we have to have that within our framing structure, that we understand that, okay, there's already going to be harm happening, and then consider what we should look at unintended consequences. We should look at the harms of action for climate mitigation, but in that framework. And I wonder if the NIHR, like when people, particularly people who might not be already within the university system, already within a research community, but maybe they've got a good idea, maybe they want to do some research in this, or even people who are, in particular departments with particular expertise, but they don't really understand the whole bidding funding process. you know, if you see somebody who's got a good idea, but they've put in the wrong application for the wrong funding call, you know, how can we sort of say, oh, there's a really great person here who's doing some fantastic work. Team up with them and do your idea together. Like, actually research supporting people to connect up with all the other people in the community who can actually make that happen. So apparently there's this thing called, this is one of my friends told me about this, there's this thing called live reviews, where you keep publishing your evidence and the users can interact with the data as it's coming through. So you don't have to, you know, publish the final review, but it keeps getting updated. Maybe we need to think about something with that. And then also allowing people to interact with the research. So thinking of the consumption of your research, having utilisation focus. And what about motivation to support net zero NHS research? I don't feel like I've done a very good job of that in this talk. And I think one of the difficulties for people like myself and Hilary, who've perhaps been thinking and doing this for a while, and Andrew, you know, down in the bottom row has been thinking about it for even longer, is that sometimes we can forget what people know and don't know. And I think that also everybody's in a slightly different place. So we kind of risk telling you a lot of things that you already know, or jumping ahead and making assumptions of what you may or may not know. But everybody in the research community needs to understand the impact of the climate crisis on health. You need to understand how all the research that you're doing is potentially supportive of this agenda. It probably is supportive of this agenda, because if it's working on prevention, or if it's working on an empowerment or a patient empowerment, or if it's working on making systems more effective, and if, you know, less wasteful, then it probably is working on the net zero agenda. And all of those things are obviously working on good public health, if it's working on the health inequalities agenda. But people do need to understand the impact. I wonder whether all research calls should have a sustainability impact assessment as both a requirement that research is done as sustainably as possible, but also a way of educating people about the aspects of sustainability that we should be considering whenever we're doing any activities, including research. And also, I mean, I'm hoping that you're going to recognise we're going to use the knowledge that you use immediately, you know. This research will not be wasted. This research will be used. How many people read the average paper? I don't know, it's not that many, is it? But if you can connect in with this work, because it's the most important thing that we all need to do, then, you know, this research will be implemented. I was saying a couple of medical students of mine did an audit in the practice, and they looked at all of my poorly controlled asthma patients. And at the end of it, the thing that they felt greatest about is I said, you know, we will use this work. This is not just for your education. This is not just a process. That we are going to use this, and I will let you know what happens as a result of it. And I don't think they've ever felt more useful, actually. So, you know, similarly call out to you, you know, if you do this work, we need it. We're going to use it. So how many of you have seen this diagram before, the donut of social and planetary boundaries? I perhaps should have put this at the beginning. So this is a diagram by Kate, Hilary, how do I pronounce her surname properly? Is it Kate Raworth or Kate Roth? Gosh, I haven't known that all this time. I've been pronouncing her name incorrectly. She is an economist based in Oxford, and I would very, very much recommend, she's done a 15-minute TED lecture on donut economics, which is just brilliant. And she talks about how economics has to change so that we're all living within our ecological ceiling, but that nobody is falling below the social foundation. So we all kind of understand in the health community, in the health research community, the impacts of those wider determinants of health. You know, we recognise that housing and, you know, education and the supply of food and all of those things that are nothing to do with healthcare, actually, those wider things have a huge impact. So everybody deserves that social foundation. But actually, we don't exist separately from our planet. We are part of the living biosphere of the planet. And our life support systems, the ones that give us the stable temperature which allows human civilization to exist, the ones that give us fresh water and clean air and the ability to grow food, there are planetary life support systems, and we need to live within that ecological ceiling. And I remember thinking, when we had the pandemic, we still are in the pandemic, but that sort of period where we were literally changing everything around, the way that we made our decisions was on the basis of, can the NHS ITU departments do they have capacity for any more patients? We can't afford for the life support capacity of the ITU systems to be overwhelmed. That's what they meant when they said the NHS was going to be overwhelmed. I mean, there was wider things as well, but that's what they meant. We cannot afford for our life support systems of our planet to be stretched to the point that they can no longer support our healthy life. And so we need to live within this, and our planetary life support systems need you. Thank you.
Really great thought-provoking talks. Hilary, if you join us down here. Now, the questions have been coming in thick and fast, so I think if I start with a question for you, Aarti. So there's a couple of questions around waste. So both what we really need to do to tackle waste in the health services, but in terms of disposing of medication, paper and so on. But then a sort of linked question about what's happened during COVID, where perhaps the threshold for clinical waste has been lowered because of infection, fear of because of the need for infection control, and how can we have a sustainable waste policy?
Gosh, that's such a big question. So when you map out waste, if you look at medicines waste, it's at so many different levels. Some of it is about whether or not we're prescribing medicines that are actually needed. Some of it is about whether medicines are dispensed, where patients don't need, they're just being dispensed, they're not actually being used. So that's from the sort of clinical patient perspective. Then you've got things like expiry dates. I learned recently that medicines' expiry dates are like for 2 or 3 years, but they actually last for 15 years. So, there are issues around that. Specifically around the waste for the personal protective equipment. So we've had a culture around infectious diseases which has been very risk averse, which is like we can't afford for anyone, basically, I think, from Creutzfeldt-Jakob disease. When prions happened and people were like, oh my God, what are we going to do? How can we protect people from prions? And most of it is no longer evidence-based. So we need to bring the evidence back in. Is it really evidence-based to wear gloves for every single patient you see? I think it's probably better to wash your hands. There's a lot of unnecessary stuff that we do. We changed, bed rolls for every patient, even when there's no bodily discharge. If there's no splash. So there's an evidence-based thing here. But it's also about our tolerance of what we think is okay. So if one infection were to slip through, is that okay? And I guess that's the bit about what is the harm from the waste. That needs to be put into the thinking. We can't just sort of say, well, that's zero. There's no harm there from the waste, because that's how infection policy is happening at the moment, is people are just going, well, that doesn't matter. We just got to stop that one infection. And that's not really fair.
Really important trade-offs, tensions, and thanks for those examples. A couple of questions for you, Hilary. So, first of all, should we assess public views through what people say about climate change or what they actually do? And then a few questions around younger people. And obviously your work was largely around 18 and over. Do you think you'd have got different views canvassing under 18s?
Great questions. Can I take this second one first? The future generations dimension is hugely important, and for those of you who work in the area or have got family, you know that children and young people have no voice and rely on adults to do the campaigning and the advocacy for them. One of the worries I have, in addition to that, is that some public involvement activities are trying to garner public views now, and those have to be filtered through a future perspective. So, for example, if you ask communities what they want, it may not necessarily be the priorities of those coming down the track. So I think the ethical question about how we represent future generations is really, really important. And would we get a different view? Yes, definitely. And if you look at what's happening within the education system, we have a new cohort, multiple cohorts of children growing up who have very, very different understandings of the planet and the need to protect it. On the other question about perceptions and behaviour, yes, it's really important. What we've been looking at is perceptions. In general, there is a gap between what people say in terms of concern and what the actions are. And I think behaviour change brings climate change right back into our territory. And I think it's been one of the assets we've yet to exploit. The major resource of understanding on how to change behaviour comes from health services research and health research. And if you look at quite a lot of the stuff, the policies, not stuff, policies that are coming forward, there is starting all over again. If you look at some of the work that's been done on behaviour change in relation to climate change, it desperately needs the insights from the public health research community. And at the moment, there's a huge gap between concern and action, yes.
Thank you. And another question that got a lot of votes, perhaps to both of you. So can you outline actionable strategies to help researchers convey to the public the impact of climate change on health? How do we make them care? I think you both touched on this in your... perhaps you were talking, Aarti, more about, connecting with clinicians, but any other thoughts?
So I can tell you a story. So I've been talking about air pollution in terms of numbers and things to clinicians and, public health research community. And then when I went to the latest COP in Glasgow, Al Gore told the story of a child who's born in Warsaw, who in the first year of life, and I don't really know where he's got these statistics from because they're really horrific, inhales the equivalent of 20 cigarettes a day. So 1,000 cigarettes in the first year of life, which is outrageous. And, we wouldn't tolerate that, would we, if it was an actual cigarette? So I think stories, maybe, and immediate stories, and stories about them, and stories about their neighbours, and stories about their community, and stories about health. So, but also the potential positive vision that this enables. Because I think people still think of climate action as things that they have to give up. I have to give up meat, I have to give up my car, I have to give up holidays abroad. And actually, what we're potentially going to have with climate action is a much happier, kind, inclusive, healthy environment for us to live. It's a really, really positive vision, and we should be pushing that positive vision, I think.
Again, it's an excellent question. I've got a couple of observations. I have concerns about net zero as a public health message for two reasons. One, net zero is in danger of, or has already become, a wedge issue. It's become a rallying call to be anti-net zero if you're anti-climate action. I much prefer some of the terms that Art has been using. really about trying to create a safer, healthier world. And I would avoid net zero if I was engaged in public engagement. The second reason I don't like it is that it focuses on mitigation, and we've got a huge adaptation challenge. So I really think that the health research community doesn't want to ally itself to mitigation only. We desperately need to invest in adaptation, and adaptation that has mitigation co-benefits. So I'm unhappy about net zero as a kind of rallying call for action. The second thing I would observe is that if you look at studies where communities have experienced climate change in its hard, extreme forms, they have a very different set of attitudes to climate change and health. So if you look at studies of flood-exposed communities, and if you look at studies of air pollution, experience changes understanding. So I think if we're going to be talking to the public, we have to be talking through an experiential lens. And what comes out of that as a sort of third point is I don't know how to do this, but we desperately need to change the language that talks about climate change. And I'm going to have to put my specs on. I'm going to say two both of us have mentioned these quotes, right. The WHO State of the Climate, which is what Tara mentioned, where the re-evaluation of how quickly we're going to reach 1.5. What it said was brilliant, but it was scientific. 4 key climate change indicators: greenhouse gas concentrations, sea level rise, ocean heat, and ocean acidification set new records in 2021. Yet another clear sign that human activities are causing planetary scale changes. Correct, but in terms of a public health message, absolutely incomprehensible. So I think we've got to find a way of turning climate change as a global change in climate patterns into a language that people understand. And I think that could be a bridge to engaging the public.
Fantastic, both of you. So stories, research, experience to change the not now, not here, not me that you were talking about in your research, Hilary. I'm afraid we're out of time. Can I just ask you quickly on your Slido to just answer the question, how many of you are thinking of doing research in this area? What you might broadly call any research around sort of sustainable health and social care. And while you're doing that, as well as thanking the terrific speakers, they've certainly given me real food for thought. Can I also make a plug for the last plenary session just after lunch at 1:45 on the sort of related, in a way, theme of research on health inequalities, again with great speakers, and also the opportunity for you to hear who will have won the awards for our future leaders in health service research and our new award for inclusive research. So it's great to see over half the collective audience, including those at home, are planning to do research. And I think Aarti and Hilary might say we'd want that to be 100% given the urgency of the problem. But if you'll join me in thanking Hilary and Aarti.